Hi, I'm Jason Wagner, Sarasota Vascular Specialist, and thank you for joining me for another Whiteboard Wednesday. Today we're going to talk about the importance of veins in their role for a hemodialysis access to be created. If you're going to have a fistula or a graft placed in your arm, we need to know what are we connecting to what's going to be used. As a quick reminder, a fistula is when you have a vein sewn onto an artery and that vein gets nice and big under the skin with a lot of flow in it, and that's where they access for dialysis. If you don't have a good vein, a superficial vein for dialysis, what we'll do instead is we'll connect an artificial vein called a graft between the artery and the vein higher up, usually a deep vein. As a quick reminder of our anatomy, we have down at the wrist, the cephalic vein that runs right along the side of the thumb and along the top part of the arm. And that comes actually all the way up and connects into the shoulder and goes down back to the deep system up here in the chest and in the shoulder joint. There is also the basilic vein, which is a superficial vein that runs along the medial part of the arm and then kind of dives deep about right at the level of the bicep and then becomes a deep vein higher up in the arm. There's also the radial and the brachial veins that are deep down in the arm, and that's usually where we'll plug in a graft. When it comes to a fistula, we want to start as far out in the arm as possible. And so for us, the absolute minimum vein size we'd want to use is about 2.5 millimeters. The next thing we care about also is the artery, because we want to make sure that whatever we're doing to take blood flow away from the hand to make that connection between the artery and the vein, I want to make sure that it's a good healthy artery that I'm plugging into and that there are no blockages or anything in the arterial system. With arteries, we can feel for a good palpable pulse at the wrist. So we'll feel down right here and see if there's a good pulse at the wrist. If there is, that's a good sign that blood flow is pretty decent down to the hand. We'll do additional testing with an ultrasound to take a look at the artery and the flow in all of the arteries of the arm, starting right about the level of the chest all the way down to the arm to make sure there's no what we call silent lesions or things we don't know about. Additionally, it's going to tell us the artery size so we can plan for the right size anastomosis to make, where we have the actual connection between the artery and the vein. It's also going to help us plan so we can make the smallest possible incision, knowing which vein is closest to which artery and what part of the artery is good to connect to. It also helps us know if there's any calcium deposition or plaque in the artery so we can make sure we sew to a good healthy part of the artery. When it comes to the veins, similarly, ultrasound helps us map them out and see what's big enough, what's not big enough, if there are any chronic changes. When it comes to hemodialysis access creation, so fistula or graft placement, we want to do it in your non-dominant arm. I'm right-handed, so for example, I would hope to protect and use my left arm as my dialysis arm. The reason for that, if I'm sitting in the dialysis unit, I can text, I can eat, I can talk on the phone, I can do all my normal things with my dominant arm, and everything else dialysis-wise, this arm's not really allowed to move much, and so they can use this for dialysis. We want it to be about 2.5 millimeters in size, and we want to make sure that there are not a lot of branches or weird areas of tortuosity or any other problems that might make it a problem for a dialysis nurse to stick, because as we make that connection, as the vein grows, if it's already a very squiggly or tortuous vein, we want to make sure that we're not trying to connect to that, because that's going to grow and still stay really squiggly and be tough to have the needles go into and work well. The other thing it helps us know is where that basilic vein connects to the deep system. So you can have a really nice sized vein, but if it doesn't really have a good long length to it, then we're not going to be able to have a lot of luck making it superficial or bringing it to the surface. When it comes to our mapping, the things we care about is the size of the vessel, make sure that there's no scar tissue in the vessel or around the vessel, and then where that blood vessel is relative to the artery, if it's a vein, and where the artery is relative to the vein and the vein relative to the artery, because that helps us create the smallest possible incision to make that connection a good, meaningful, long-lasting connection. If you don't have a really good size vein, like a cephalic vein or a basilic vein, that's okay. Our vein mapping will also look at the bigger veins that are deep down higher up in the arm, and that's where we'd use as our venous outflow connection for our graft, because we're still going to sew to the artery down here in the forearm or in the upper arm, but we're just going to have that artificial vein connect and plug in higher up. If that area in the artery where it splits is not down low by the elbow like it is in about 75% of people, that's okay. It's good to know that in advance so we can plan for a different type of graft to be used higher up in the arm. So when it comes to dialysis access creation, the things that matter are having a good artery, having a good vein. The vein's not good, having a good deep vein to connect to higher up in the arm. The way we can tell, some of it's by physical exam, some of it's by ultrasound, and it's important to make sure that, if you're nearing dialysis or in need of dialysis, that you're protecting your non-dominant extremity. If you have any questions or concerns or comments, please feel free to reach out, leave a comment below. Again, I'm Dr. Jason Wagner, Sarasota Vascular Specialist. This is another Whiteboard Wednesday.